Um, what are the, let's pretend, I'm going to give you a couple of questions here. So let's pretend you've reached the end of your workday at whatever time that it closes. What's your typical time that you wind up truly finishing and now you're heading home?
It's variable. 5:36, 6:30. Some days it's 5:15. It's so variable. So much so that I can't really commit to evening things because last patient can be, it could be a very sick child needing lots of attention.
Okay. So let's say that you finish your workday and now you look back across that workday. What are the thoughts or feelings or reflections that you hope to have when you've had, at the end of each workday, what are the things as you look back on it that pan through your mind and heart? What are you hoping those thoughts and outcomes were?
Most every day, at the end of the day, I look back and I am asking myself, did I make a difference? And I'm looking at just the span of the day, who came in, whose lives were touched, what kind of care was given. Oftentimes reflective, how could I have treated that patient better or that parent better? Did I show the frustrations I may have been feeling? Did I seem hurried when I know I was hurried? Those kind of thoughts, those reflective thoughts to think, did I care for them the way that I would have wanted to be treated or the way that I would have wanted my own child to be treated? So, and sometimes, end of the day reflections, in my mind, necessitate me calling a family and just saying, how are they doing? Or any questions that you had, because I recognize, again, was I hurried? Did I take the time that they needed? Even though I may feel that I've provided the care that they needed, do they need more? And so, just to sum it up, at the end of the day, is did I make a difference? And hopefully that was a positive difference in the child's life.
All right, what are some, as you dealt now, how long have you been in your own pediatric practice? How many years?
11 years. I've been here 11 years.
Okay. Now across that 11-year spectrum, what are 2, 3, or even 4 of the most, let's call it counterintuitive things that you have felt you needed to convey to parents? So in other words, as a parent, we might have certain intuition, a certain sense of things, and sometimes the reality can be very different than our native perception. What are some of the things that you find yourself having to educate parents about that kind of cuts against the grain of common thinking, or not even necessarily common, but common enough that it's noteworthy in your mind?
Sure. So we call it the practice of medicine because things are always changing, things are always evolving. And so there are things that we encounter that 10 years ago would have been blatant, firm recommendations that now we say, don't do that anymore. One thing that we continue to educate parents on is how a child sleeps on their back. Since the 90s, it changed quickly from put a child down on their stomach to sleep to now put them on their back to sleep. And so we have parents who are of childbearing age who have their parents who remember how it used to be. And so oftentimes we're having to educate our parents to say, no, what the child's grandparent recommends is no longer recommended. And so that it does seem counterintuitive. Just basic care of a newborn. Simple examples of how to care for an umbilical cord. It used to be we told parents to wipe it with alcohol several times a day. And then the recommendation now for over a decade has been just leave it alone. Let the body take care of it. Having to educate parents regarding that. Another aspect would be nutrition. We see just a plethora of food allergies these days. And so what we used to recommend 10, 15 years ago regarding specifically strawberries, shellfish, peanut butter, are some highly allergenic foods. Years ago we said don't introduce those until 1 to 2 years of life. Now, even as of a few weeks ago, our recommendation is that we should be encouraging families that as early as 4 months to begin introducing things like peanut butter, which again it seems very counterintuitive based on the information that's been out there for years.